Mia Tackney is a postdoc at the MRC Biostatistics Unit, where she works with Sophia Villa. Her work focuses on statistical methodology for clinical trials that use wearable devices to measure outcomes. And before joining the Biostatistics Unit, she was a postdoc at the London School of Hygiene and Tropical Medicine, where she worked on missing data methods for trials that use accelerometers. And prior to that, she received her PhD from the University of Southampton in experimental design. And her talk today is on handling missing data from wearable devices in clinical trials.
Thank you very much. So I'm really delighted to be at this event, which is all about data that comes from wearables. And I'm even more delighted that I can talk about the data that you don't get from wearables, because it's missing for some reason or another. And this is joint work with Elizabeth Williamson and James Carpenter, with whom I did a postdoc at the London School of Hygiene and Tropical Medicine, and our collaborators at St. George's. So I'm primarily interested in the setting of clinical trials, and to illustrate how wearables might be used in this setting, I'm going to talk about the PACE-UP trial. So this was a London-based trial that asked the question, can a 12-week walking intervention increase people's physical activity? So in this trial, people had to wear an accelerometer for 7 days. I've brought one here so you can see it. It's not as glamorous as some of the other devices we've heard about. It doesn't measure your heart rate. It's not going to listen to you snoring. It just measures acceleration in 3 dimensions. And after this baseline period, people are randomized to one of 3 groups. They can either do a 12-week walking intervention that is given to them by post, or they can do a 12-week walking intervention with nurse consultations, or if they're in the control arm, they are asked to carry on with their usual activities. And after this, they are asked to wear the device again for 7 days, and the idea is to compare the baseline and follow-up to see if there's any change in their physical activity. Now, this is what 7 days worth of accelerometer data might look like. We are looking at epoch-level data, so this is data taken at 5-second intervals, and it's measuring the acceleration in 3 dimensions, which is then summarized into something called vector magnitude. So that's what I'm plotting here. And in this setting, missing data is very common, but it's a little bit hard to grasp. So first of all, if you remove this device, it may be missing data, but if you sit still and you don't move, it kind of looks like missing data. So you can see in this little interval where no activity is detected, it's difficult to distinguish between missing data and inactivity. Secondly, people don't have to wear this device in their sleep. So in this little interval where no activity is detected, it's hard to tell if they were having a lie-in or if they actually forgot to put on their device in the morning. And here you can see there's a portion of the day that's clearly missing, but you could also have, for example, the entire day that seems to be missing, or most of the week that seems to be missing. So how do we really define missingness? And once we define it, how do we handle it in the analysis? So I'll tell you a little bit about what seems to be current practice, at least in my experience. So we're going to measure activity in terms of the average step count across the week. So actually, we don't really need to pay too much attention to this epoch-level data. Let's look at the day-level summaries so we can see the total step counts per day. You can also get this thing called wear time per day. So this is just the amount of time people wore the device, excluding any period longer than an hour where no activity is detected. And a missing day is declared if the wear time is less than 540 minutes, so less than 9 hours. So by this definition, you can see that this day here where almost no activity is detected, this is declared missing. But this second day up here, the person wore it for 539 minutes. This is declared a missing day, and those 4,593 steps, this does not enter the analysis. So this approach, this choice of threshold 540 minutes, it's a little bit arbitrary. It leads to loss of data. And it also assumes that days are missing at random. So we're assuming that on these days where we declare missing data, that those days people are probably acting similar to the other days which are observed. the missing at random assumption, but of course this might not be realistic. At least I know from my own experience of using wearables that on days where I'm a couch potato, I do not wear my device. So this is a missing not at random mechanism. So our idea was to say, let's bring a bit more attention back into this epoch level data, this finer level data, and see if we can think about missingness in a more precise way. So the first thing we did was to look at lots of these kinds of data sets and try to classify intervals of people's activity into different types of activity that's going on. So I'm just going to illustrate an algorithm that I came up with through some examples. So I'm illustrating in black the active periods where we have continuous activity. And in blue, I'm assuming that this is sleep. So it's areas of 5 to 12 hours where no activity is detected. And something we realized is that when you put on this device and when you take off the device, this makes a big movement. This thing can feel that I'm moving it around. And you can actually see this in the data set. So you can see these areas where you have spikes, high vector magnitude. And with this, you can detect when the device has not been worn. So we call this non-wear, and we want to see this as an instance of missing data that may need to be imputed. In contrast, an inactive period is a period where no activity is detected. However, there's no evidence that the device has been removed. So maybe someone's just sitting very still in front of the couch, or they're taking a nap, something like that. And for us, something that we found quite challenging was something that we called sleep extra. So this is a period of a long time that's kind of too long to be sleep. So they probably forgot to put on the device in the morning. And the challenge there is to identify when can we reasonably assume that they would have put on the device. So we did this by looking at the average of the active windows for weekends and weekdays separately. So this is kind of a way of trying to identify the missing intervals. And what we wanted to do next is to use multiple imputation to handle missingness. And to give a very brief sketch of how this works, after you identify the missing intervals, what you want to do is to replace these missing intervals with plausible values of what the activity level might have been. And you don't do this just once, you do this multiple times, let's say m times. Each time the imputed value is slightly different, which reflects the uncertainty around the missing data. And that gives you m complete data sets, which you can analyze separately, and you can combine them to create a pooled result. So how do we come up with these imputed values? Well, we proposed a non-parametric approach where you try to replace the missing value with possible donor data from the same person, if possible. So we're going to assume that people's activity in this missing interval is similar to that from other days, but from the same time of day, from the same person. So if you can find at least 4 possible intervals to impute with from the same person, so if there's at least 4 in your self-donor pool, you impute within person by selecting at random for your imputations. But if there's too much missingness throughout the week, you may need to find another person to impute the data from, and you do this by matching, trying to find a person that is as similar as possible on some demographic variables and variables related to activity levels. So this non-parametric approach, we have a paper that is under review, but you can find out a bit more about this approach to handling missing data for accelerometer outcomes in trials. And I'm going to bring back my couch potato, because here we discuss how you can handle situations where you cannot assume missing at random. So now I'd like to talk a little bit more about the work that I'm doing here at the MRC Biostatistics Unit with Sophia and with Mark Toshner and Joe Newman. So we are looking at the area of trials for pulmonary hypertension. So this is a rare disease that can affect the blood pressure in the arteries that go to the lungs, and it can affect people's ability to do exercise. And in this setting, the primary outcome, the gold standard outcome, is an in-hospital 6-minute walk test. So essentially, people have to come to the hospital and walk between these 2 cones for 6 minutes, and the distance they cover is measured. And this is seen as a measure of people's functional capacity. But it's done in a rather artificial environment. People can become very tired once they get to the hospital, and that can affect the result. And it's also quite a big burden for the people who have to come to the hospital. Maybe they don't live that close by. And so what Mark and Joe at Royal Papworth Hospital are doing are trying to validate a 1-minute digital walk test. So people can do this with a Garmin watch and with an app from Apparito that they've been working together on. And people can do this just outside of their own home, and they can do it at a much higher frequency than if a hospital visit is required. Now, in order to validate a digital outcome for the purpose of a clinical trial, you have to show a number of things have been achieved. So, for example, you have to show that this new outcome is accurate in measuring the intended health outcome, that it's correlated with the gold standard, and that it's sensitive to change over time. But beneath these big questions, there's lots of methodological challenges that we'd like to address. For example, how do we handle missing data in this setting? And for example, how do we handle the fact that there is a learning effect to using these wearables and using these apps that can count how long it takes for you to do a 1-minute walk? And even though wearables are becoming more and more part of our daily lives, their adoption into clinical trials is still at a really early stage. So at the moment, there's only one clinical trial, only one outcome that has been approved to be used in clinical trials, and this is for Duchenne muscular dystrophy. So this is an area that has lots of potential, and it needs lots of brains from people like you in this room and joining online. So if you have any interest in this, please do come speak to me, or you can speak to Sophia, who's chairing the next session, or you can speak to Joe, who is there. He's the person who is at Papworth working with Garmin and Apparito in these pulmonary hypertension trials. So thank you very much for listening.